Kendra Edwards, and welcome back to the CarDon Resource Hub. And I'm really excited today because we have Allison Myers with us, and she's a speech pathologist here at CarDon. And Allison, I'm really excited about this program. So tell us a little bit about the Speakout program.
So Speakout it's an evidence-based speech therapy program that was developed by the Parkinson Voice Project down in Texas. And it's specifically designed for those individuals who are living with Parkinson's disease and other similar neurological disorders. The program focuses on helping people just improve and maintain their speech and voice and just overall communication as the Parkinson's disease progresses.
So, Allison, tell us what sparked your interest in getting involved in that and learning more. And did you get certified in that program, or how does that work?
Yeah, so as a speech language pathologist, I have spent my entire career working with the geriatric population and just helping these individuals maintain their quality of life through communication a lot of times. I've repeatedly seen how Parkinson's disease can affect not only a person's voice, but also their confidence and participation in social interactions and just independence. So when I learned about the Speak Out program, I was really impressed by just the meaningful outcomes that these participants were having. Seeing people become more confident in conversation with family and friends. It's just incredibly rewarding, and that inspired me to pursue a certification. So yeah, I am a Speak Out certified provider.
So give me more specifics about what is the Speak Out program? What is it a specific type of treatment that you're doing, or what does that look like?
Yes. So it is a very structured speech therapy program. We would start with a comprehensive initial evaluation and just assessing the person's vocal intensity, their breath support, articulation, intelligibility, and then, determine if that person is stimulable to the treatment. And if they are, we would decide, okay, we're gonna do this. We're gonna set up an individual, therapy program. So after that initial evaluation, the program's designed to provide 2 treatments a week, 2 sessions a week for 4 weeks. Each of those sessions would be about 30 minutes. And then we would also provide that individual with a home exercise program, which I think is probably the most important part of the Speak Out program, is these home exercises that they are doing on their own with caregivers, just to achieve the best outcome. And then once those individual sessions are completed, we would then transition into a weekly Speak Out class, just to continue practicing, staying motivated, maintaining that progress. And this would be with other individuals who have also completed the program. So it'd be kind of a group setting where, people can get those communication, the communication practice. So
I love the thought of the group setting too, because I think a lot of times in that, as an individual that has Parkinson's and their speech, they become isolated and they are uncomfortable with that piece of it. So knowing the communication is just so important. And so building that up and keeping that going is so important. And being around other people, I think is always.
Absolutely. It doesn't feel so isolating, and yeah.
So question for you, Allison, do they have to be in a CarDon community to benefit from this program?
No, not at all. We do outpatient therapy as well. So, if somebody wants to seek out this program, they can get a referral from a physician, a neurologist, primary care provider. They can also contact Hamilton Trace directly just to schedule an evaluation, or even just discuss if the program, would be a good fit for their needs.
So is that the best way? Would they call Hamilton Trace and ask for the therapy department, or what should they do?
Yeah. And so our therapy department, our rehab supervisor, They can reach out, and the number there is 317-813-3443. Or they can just call the front desk and ask for the therapy department, and they can transfer them over.
That's great. I'm excited that we have the Speak Out program, and I really appreciate you getting certified and doing what you're doing, because I think it's going to be such a benefit for so many people that reside at our communities, but really the community at large. And that's what I'm really the most excited about. So thank you.
Yeah, we're excited.